Now, with the expectations of what can a chiropractic adjustment do, it's a vast variety of different outcomes. Some patients can, especially depending on what they're coming in for, some patients can be in acute pain and we do 1 or 2 adjustments and they get immediate relief. Whereas then we have patients who are coming for a chronic pain they've had for many years. The expectation is definitely not going to be the same. So the first 3 adjustments initially, especially the first 1 or 2 adjustments, the patient is going to be 50-50. Some patients can be in actually more pain, for example, or some patients can get some immediate relief. The ones that have more pain is because there's already underlying swelling there. There's already a lot of inflammation in that joint. So as we go and adjust that area, it's going to stimulate the nerves even more. So potentially they can feel actually worse, especially the first 1 or 2 adjustments. That's why we always advise ice. We always want to ask patients to go for a walk, try and do plenty of walking throughout the day, less sitting, and lots of ice. Once the swelling starts to subside, then a lot of times it means that the patient can start to improve. And after, say, the 4th, 5th adjustment, that's when we can start to get more longer-term stability. After the 7th, 8th, 9th adjustment, then hopefully it can start to stabilize more and more of a longer-term outcome can result. So what we say is that the first 9 adjustments, if there's no improvement at all, most likely we can't help the patient. We always use 9 as a good guide of indicating, okay, is the patient getting better or is the patient staying the same? We don't like the patient to stay the same. That's not a good sign. We always want to see some improvements. And we should be able to feel it. As a patient, they can feel that they're getting better. For example, they start to move better. They start to say that they can start to sit longer. They start to sleep better. The digestion improves. Those are good signs. Whereas for our point of view, it's more of motioning. Is the segment getting better? Is it starting to become less swollen up? Is it moving better? And we can also see it on the patient's face. A lot of times, the patient, you can see when they're getting better, they start to smile. They're a lot more happy.